Hi, everybody. This is Chris White again. I have a visual aid here. This is my daughter, Paige. Hi, Paige. So this is a informal demonstrative video. It's supposed to be about a skill that we can use, or that we all, I am used to. One of my skills in the military was I was a combat lifesaver. Now, with that, it was being able to use first aid, not only on myself, but on a buddy, but it also was a way to assist the medics in giving first aid so that it can further assist them to getting triage and things like that and helping them get to an aid station or to a casualty evacuation. So, the one thing that I wanted to do is I wanted to demonstrate CPR. Most times, that's the very first thing that you come across. It's very important. So let's go ahead and get into it. Now, whenever we did it in the military, we had to do what's called scene safety. We had to make sure the scene was safe. Now, since I'm in my own home, my scene is very safe. So what we want to do is we want to assess the patient. The main thing is you want to check a pulse. Now, a lot of people, there's one here in the carotid. It's right below the jawline. You can feel it there. There's also one right here. It's called the radial pulse. So I can actually take her arm and using my front two fingers, you never want to use your thumb because your thumb has its own pulse. So I can actually take her pulse right here and I feel it. Okay, you're still alive. Good job. So the main thing is when you come across a person who's laying down, you want to ask them, hey, are you okay? There was an acronym known as AVPU that tells the alertness. It's A for alert, V for verbal response, P is in pain. Way to get that. This is going to hurt. That's pain. Or U for unconscious or unalert. They don't respond to any of that. So even though this is my visual aid and she's alert, we are going to act like she is unconscious and that she's not alert. So again, we're going to check for a pulse. Even though she does have one, we're going to say that she does not have a pulse. Okay, you can check both sides. Okay, so now where I'm getting my information from, yes, is from the military and all the doctrination and training manuals that we have. But I also looked up the CPR.heart.org. This is from the American Heart Association. CPR stands for cardiopulmonary resuscitation. It is an emergency life-saving procedure performed when the heart stops breathing. Immediate CPR can double or even triple chances of survival after cardiac arrest. The main two things, there are two vital steps. Number one is call 911, and number two is push hard and fast. The conventional CPR, which is like a one or two-person CPR, uses chest compressions and mouth-to-mouth breathing at a ratio of 30 compressions to 2 breaths. The chest compression rate is 100 to 120 compressions per minute at a depth of 2 inches. Okay? Now, I'm not going to get a ruler out and say, oh, this is 2 inches. Now, again, because she is alive and I don't want to do any damage, I'm going to just show how you hold your hands and where approximately it should be. So if you can roll on your side for me, arms down, just roll on your side. Okay. So what you want to do is you literally want to take the jawline and the center of the chest. That's where you place your hands. So for her, I know it's kind of weird, it's my daughter, I will take my hand and I will place it in the center of her chest, which will be right here. The heel of your hand will be placed here. On women, it's usually between the breast line and the other area, okay? Again, this is a class, so I'll be careful. All right? Put your tartar sauce back in there.
Oh.
So the chest compression, again, is at a ratio of 30 to 2 breaths You're just going to take the palm of your head, put it on the forehead, take your fingers. This is called the head chin tilt lift method, okay? When it's like that, you get the mouth open, make sure it's clear, okay? Yes, it's clear. All right, so let's get into the compressions. All right, so what we're gonna do is a ratio of 32, okay? You're gonna take your hands just like this, okay? Interweave your fingers like such, and you're going to put it right on her chest. Now, again, I'm not going to push. I may push just a little bit, but not hard. But it's going to go keeping your arms straight, your shoulders above you. It's going to go 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, all the way to 30. Then you'll get 2 breaths. I'm not going to do it because she's got weird mouth. But again, 2 breaths, 1, 2, and resume compressions. That is CPR. That's how we assist people. Every 5 rotations, you will check for a pulse. Once you get a pulse or she becomes alert, you stop and you maintain contact with 911. So Paige,
Oh, am I rolling back over?
wave to everybody.
Oh.
Thank you, Paige. And thank you, everybody.